Hello, students. Welcome to the Anatomy Uncut YouTube channel. And this video is specially made for those students who have missed part or most of the general anatomy and they have taken the admission in either third round or second round. So, those students who, for any reason, have missed out on larger part of the general anatomy, I'm trying to give them the key concept so that they catch up with the rest of the people that have been already studying the human anatomy. And this is the basic thing that you need to know, the general anatomy. So in this review lecture of the general anatomy, I have specially handmade, some of the line diagrams, some of the very important conceptual diagrams for you to understand the basic subject. So let us start. See, I want you to know first the important topics that you have to cover in the general anatomy. See, I think this is the most important that you first understand the basic terminologies of the subject, without which you cannot understand anatomy. Second thing, you have to know this tissue that is known as bone or the osteology, the part of the very core subject of the anatomy is the bones. And what about the bones you have to know generally. This chapter is the most important, one of the most important chapter in the whole of the anatomy is the bones in the general anatomy. The joints of the bones becomes very important because without the basic knowledge of the joints, it becomes difficult to write correctly the different varieties of the joints that you see while you study the anatomy in a regional approach that you are very soon going to study. The muscles, about few of the points about the muscles which are overlapping with the histology, but again, if you have missed this, no need to worry, we are going to cover that. Blood vessel, the basic types of the blood vessels, what to look into that, what are the functions of that, everything we are going to study. The connective tissue is very much important. Again, overlapping all these muscles, blood vessel, connective tissue, even the skin and the nervous tissue. These are all overlapping chapters with the your upcoming histology lectures, and at some places even that could have been covered. So the basics of those again we are going to cover here. Epithelium, embryology. I may not have the time and I may not speak about this in this lecture, but again I feel you have to have that idea of what is epithelium, what is embryology in general. So this is our list of important topics and I am going to cover most of them in this review lecture. See, in the anatomy, there are basically the terminologies, a few of the sections of few of the tissues play very important role in how you study the anatomy. यानी आपको एनाटॉमी समझने के लिए ये जरूरी है कि हम एक स्ट्रक्चर को किस तरीके से देख रहे हैं, कौन से एंगल से देख रहे हैं. उसके लिए planes used in the study, there are few basic planes that you need to be aware of. See, I have taken the primitive type or for the example the brain as your tissue and how you study the brain. This is your front part, this is the back part, this is the upper part, this is the lower part of the brain. Now if you take a section of the brain that divides the brain into anterior and posterior part, this will be a coronal plane. You can see the half of the brain pushed in front, where you see one of the part of the brain pushed behind. So these planes will enable you to see the brain from this angle as well as this angle. Now, if you have another plane that goes through the brain and it divides into the upper part and lower part, that plane will be called as horizontal plane. See, coronal plane, generally we say it is along the coronal suture in your skull. That is from where it passes, so it is known as coronal. You can also call it as the transverse plane. Okay, it's more like a transverse plane, synonymous around that. So coronal plane dividing your brain into anterior, posterior, or the front and back part. For now, because you may not be aware of the anterior, it's a term that we use in the anatomy for the front part, and posterior we use in the back part. Okay, so the back is front, sorry, the back is posterior, the front is anterior. Now, these are the two planes that you have seen. What is the third plane is, if you take the brain and you divide it into equal the right and left part. Here, if you divide it into this way, one part goes here, and the other part goes here. So this type of section we call it as the sagittal plane. So this is sagittal plane. Remember this. So these planes are very useful because different structure will be studied from different angles, and you have to be aware of how they are actually studied, which is the view, which is the plane that has been presented in that study. Some of the, again, few of the important key concepts. Now see, you take 0 as the median, that is the middle point. If you go on either direction of the 0, there are anatomical terms that can be easily explained. If you compare 1 to 0 on the right as well as the left side, and in comparison to this two number, the one is medial. Okay, in comparison to this one, this two is lateral. This two is lateral to 0 as well as 1. So these are relative terms which are used for the position of a structure. Say these fingers, this is the middle finger, this is medial, this is lateral. These two are lateral, these two are medial. This is the middle finger is the median plane, the axial plane. These two are the medial in comparison, and these two are the lateral. So what I mean is the positional terms, the median, the medial, the lateral, they are important. You know how to use them, and how, what do you understand by that mention. Superior is the upper side, the inferior is the upper side, lower side. So you know there is another synonymous term with the superior, especially in the embryo part. We call it as cranial, and inferior we call it as caudal. See here, I have shown you another term, anterior, also synonymously used with the ventral. The posterior you use with the dorsal. So these basic terms are very important, that you know what is mentioned is how it is positioned and in what direction they are mentioning it. So remember, these two slides play basic role in understanding the structural anatomy. Okay, so let us go ahead. Now, with regard to the position of the arm, especially in the joint positions and all, there are few terms that you again need to know. See, if the angle between the two surfaces decrease, we call it as flexion, and very well explained in the elbow. This is the flexion. If you go this way, opposite way, that is known as extension. When the angle between the two surfaces increase, okay, adjacent surfaces rather. This is another positional term where you see a proximal part which is nearer to the body, the distal is away, or the peripheral part of the body is distal. Now, with regard to this position of the hand, if your hand is coming towards the body, it is known as adduction, and if it is going away from the body, it is called as abduction. If it stays in the midline, okay, say something is in the midline, it is already adducted. So the adduction means coming nearer to the midline plane, okay, and abduction means a structure is going away, or that movement is taking that structure away from that midline plane. So if this is your body, or this is your one of the finger, if two fingers are going away, they are abducting. If they are coming again closer, they are adducting. So abduction, bd, comes in that word. So where p and d are, you know, distant, b is away from the d. So remember that way also, abduction is taking away that structure from the midline, and if it is coming back, it is known as adduction towards the midline if something is coming. So this is the adduction. There are other terms. If you are rotating something nearer to the that axis towards the body, if that structure is facing towards the body, it is known as medial rotation. If it is going away from that body, it is known as lateral rotation. If you put your palm upward, upward, this way, this is your supination. If you can keep it this way, this is your pronation. So palm facing upward is supination, palm facing downward is pronation. And if you compare eversion and inversion, it is related to the position of the foot. Everted foot is the sole facing laterally, or the lateral border is everted. This is known as eversion. If the sole is facing inwards or medially, it is known as inversion. So these two terms are again used in the, this is used in the lower limb and this is used in the upper limb, and special movements are there. So you have to be very peculiar or particular about when you study this supination and pronation later on, or eversion inversion when you study. You have to know what are the muscles that produce it. So keep an eye over these two terms. Now see this particular picture where you see a round structure. The center of any such round structure we call generally as the medullary part, and if that is having a peripheral part, we call it as cortex. Cortex is the peripheral part and the medulla is the central part. Some structure have lumen inside, some structure have surface basement membrane, and based on that you have some terminologies like luminal, basal, like that. Some structure have this kind of round follicles, this round structure which secretes something, a glandular portion generally, and in between what you have a parafollicular portion or few cells which are there in between the follicles is known as parafollicular cells. Especially in the thyroid, this kind of arrangement is there. Now this is your follicle which secretes thyroxine hormone. I'm just saying, okay. Even in the testis you have these follicles, we call it as seminiferous tubule, and the cells of similar kind called as Leydig cell. So this arrangement you have to know, few things are arranged like that in the body. In some of the gland you have a round structure inside the glands secreting your whatever secretion those glands have to secrete. They are known as acini. And few are tubular structure, more oval to a little bit tubular. So they are known as alveoli or tubules. So glands have some more different kind of appearances. They again you have to be taking a note of. Now, as I said, the bone becomes very important topic. Why? Obviously, the bone or the building material of your body. Without the bone, there is no support to the body. Without the bone, there is no attachment of the muscles, no attachment of the tendons, no ligaments, no joints, no calcium, no phosphorus, no blood. Too many things are associated with the bone. That is why this chapter particularly becomes important. Only few of the basic things I am going to talk about the bones, not the complete chapter, not possible here. Maybe you can refer to the other videos if you are really interested to learn about the bone, or you can demand a separate video if you want it. Okay. Now see, what you see in the bone is a typical appearance of the bone which has the end. The middle part is known as a shaft, and again the end where we call those ends the epiphysis. So the end of the bone are known as epiphysis, and the middle part of the bone, also known as shaft, is called as diaphysis. There is a junction of the two where we call it as the distal part of the diaphysis is known as metaphysis, which is generally a transition zone, or it is also known as the zone of the active growth, rather, because there is the active growth, especially of the length. Because of this yellow structure, which is known as metaphyseal plate, which is a hyaline cartilage in nature. Okay, I have told you the bone has two ends. Generally, a typical long bone has two ends, one shaft that is known as epiphysis and diaphysis. The bone also has a marrow cavity where it will produce the RBCs, the WBCs, will have some fat storage there. So all lineage of cells which are arising from the bone marrow, they are there. Plus, a layer of osteocytes is always there from the inside. If there is a bone damage, the bone repairs from inside as well as outside. If that coating of the osteocytes is there, in something called as endosteum from the inside and periosteum from the outside. I have not particularly drawn here the periosteum and endosteum, but remember they are the cellular, and a little bit outer side on that is the fibrous connective tissue. So fibrocellular layer, which is covering your surface of the bone, is known as periosteum, and if this periosteum is there, the bone regrows, bone repairs itself. Very important. Now, there are different types of the bone that you have to know. Based on the shape and the few of the characteristics, the bone can be classified into a few types like long bone, short bone, pneumatic bone, irregular bone, sesamoid bone, accessory bone, heterotopic bone, and flat bone. So these are the types that are most commonly asked in the vivas, and we will also see some of the short notes coming from this. There's another famous short note that you have to read thoroughly, that is the blood supply of this long bone. And that is very important even for the structure of the bone, the development of the bone. You have to know that a few of the arteries coming to the shaft, they will bring the osteocyte, they will start to produce the bone. A few of the epiphyseal arteries, few of the metaphyseal arteries, how they anastomose with each other, how they form the, particularly this nutrient artery forms hairpin bends before the fusion at the puberty, how later on in the epiphyseal and diaphyseal arteries fuse, that is nutrient artery fuse and the hairpin bends goes off. All these things are mentioned in the book in the long bone blood supply. So this particular slide becomes important. If you don't know the parts of the bone, you don't understand the blood supply of the bone. And now if you have learned this, you're definitely going to learn that even if you read once. This is very simple, but yes, technically very important. Now see, what is a long bone is having a typical two ends, one shaft. Short bone has a very cubical appearance with a two non-articular, four articular surface. Pneumatic, which has air inside air cavities with, you know, surrounding your nasal cavity. These bones are generally there. Irregular bones with irregular shapes. Sesamoid bones developing in the tendon of few of the muscles in the body. Axillary bones are those bones which are developed from the extra, ossified center or the ossification center where there is normally no bone, but the bone separates from the normal bone and it forms your accessory bone. Heterotopic bone develops at the abnormal site because of some accident, some injury. Okay. A flat bone is sandwich bone, a compact bone sandwiching your diploid or spongy bone, that is known as flat bone. So this slide becomes very important for the study of the bone. Now you observe this slide where you can see your primitive embryonic connective tissue cell, also known as a mesenchymal cells. They will transform into different varieties that gives rise to chondroblast or chondrocytes and osteoblast or osteocytes. Intermediate cells are blast. Okay, mesenchymal cell giving rise to chondroblast that gives rise to chondrocytes that secrete surrounding material we call it as the matrix, and the cartilage is formed there, where this cell known as osteoblast will produce later on into transform themselves into the osteocytes, and they'll produce the bony matrix and they'll produce the bone. See, the appearance is different, the cells are different, their material they are producing they are different, their collagen fibers are different. Here type 1 collagen predominates, here type 2 collagen predominates. Here the ground substance is totally different, rich in the hyaluronic acid. Here they are very rich in the calcium and phosphorus. You must have heard about this hydroxyapatite crystals that are there in the bones. So calcium, collagen, phosphorus, you know, this is all present in the bone. And remember, there's a basic difference in the bone and the cartilage. And if you palpate your skull and the ear, you know the difference. The skull is the bone, your ear, ossicle, your auricle is the cartilage. So they are soft, the cartilages. They are more having a gelatinous, you know, texture, and your bone is very hard, firm, and it gives generally the protection to the tissues. Where flexibility is needed, you have cartilages. Where the firmness is needed, you have the bones. See, now how your ultimately bones are formed, the process is known as ossification. Ossification, in every osteology book you will find primary center and secondary center of ossification, and where they are present, which area develops from that centers. Now what does it mean that first time in that primitive model of the bone, where the bone formation start, is known as ossification center, and if it is coming before birth it is known as primary center. If it is coming from after the birth, or if the center develops after the birth, we call it as secondary ossification center. Now remember again, a bone can directly arise from the mesenchymal cell via a method called as membranous ossification, where in a connective tissue membrane in the embryo, the mesenchymal cells directly transform into the osteocytes. The bone is formed. If the mesenchymal cell form in between chondrocyte, chondroblast, and the cartilaginous model of the bone to be formed, and then the cartilage cell gets replaced by the bony cells or the bone, it is known as cartilaginous model of ossification. So there are two ways how a bone is formed, either directly through the mesenchymal cells in the membrane called as membranous ossification, this way direct, and if it gets to that bone via cartilaginous model, it is known as cartilaginous ossification. Generally the long bones ossify from the cartilaginous model, and the flat bones they classify or rather ossify from the membranous mode of ossification. It's very important. Now you go through the details of that chapters, and if you feel that you don't understand anything, you can comment and you can ask for the explanation or a particular type of you know a concept that you don't understand, you can always ask. Now see, skull bones. Now how the bone will attach with each other to form the flexible joints or non-flexible but joints. How the two bones will intermingle with each other for that functional aspect, whether it's a protection, whether it is a flexibility, whether it is a movement, whether it is a any skillful thing you have to do with the skeletal system. A joint is the essential component there. The two bones when articulate with each other through some intermediate material, we can classify them as fibrous, the cartilaginous, and the synovial joint based on which material fits in between the two bones. If this is the end and this is the another end and this is the intermediate material, now what is made up of this material is made up of this makes your structural variety of the joints. If this is your fibrous tissue, as you can see in this group called as fibrous joint, all over you have the fibrous tissue in these three varieties of the fibrous joint, whether they are suture, whether they are syndesmosis, whether they are pig and socket like you see in the teeth. So these are the joints which are fibrous in nature. If this material is replaced by a plate of cartilage like this, in the two ends of the bone, between the two ends of the bone there is a plate. Now this plate, if it is a cartilage, which cartilage it is, that again divides these joints into primary and secondary. In the primary you have a hyaline cartilage forming the joint or in between the joint. Now here you can see the hyaline cartilage, so this becomes your primary cartilaginous joint, also can be called as synchondrosis. Okay, you can all the primitive model of your long bone, they have primary cartilaginous joint between your diaphysis and the epiphysis. Why? Because that metaphyseal plate is nothing but the hyaline cartilage. Now here I have demonstrated categorically this sternum. Okay, it's not intentionally made sternum, but it's a joint between the sternum and first rib as again a synchondrosis. The skull ka base, between the sphenoid and occipital ka base, there is a joint of hyaline cartilaginous plate, and that is very important for the growth of the skull. So the joint is again a primary cartilaginous joint. If this plate is a fibrocartilage, you don't know the cartilages, there are three types: the hyaline cartilage, fibrocartilage, and the elastic cartilage. Now which kind of cartilage fills this gap? Generally elastic cartilage plate is not present in the two bones. Either you will have a hyaline cartilage, either you will have a this fibrocartilage that you see in this slide. If this kind of plate is there, it is known as fibrocartilaginous joint or secondary cartilaginous joint, also can be called as symphyseal variety of joint. Okay, pubic symphysis, the vertebral symphysis, they are all symphyseal variety or midline joints because of their position in the body in the midline. The secondary cartilaginous joints are permanentish in nature. They do not get ossified later on, these cartilages, whereas in primary, this peculiar feature in the primary where there is a hyaline cartilaginous plate in between the two articulating areas, they over a period of time they undergo the ossification and the joint will vanish away. Like the base of the skull, it will grow, and maybe for that growth only the joint is there to grow. And one day it will stop, it will ossify into the bone. Your these bones, long bones, they'll grow, and they'll stop one day. The joint is gone. Okay, so these are temporary joints, primary cartilaginous joints in chondrosis. They are temporary joints. They'll grow in the length. They'll vanish away one day. After the puberty, after the ossification is complete, they are going to go away. So they're temporary joints. They are peripherally located mostly because of the presence primarily seen in the long bones. Whereas your secondary cartilage joints are symphyseal variety, they are midline joints. They don't go away anywhere. That are going to stay there for the lifetime because fibrocartilaginous this cartilage do not have the tendency to undergo the calcification. Okay, remember this. Now, synovial joint, a very famous joint, and you must have heard a few times this name even in the 12th class. What is this synovial joint and why it is named so? Because of the synovial fluid coming in between the two articular surfaces. And the joint are classified because of this. What is there in the two articular surface? Whether it's a fluid, whether it's a cartilage, whether it's a fibrous connective tissue. So synovial fluid secreted by this synovial membrane, lubricates this, nourishes this articular cartilages around there. And this kind of presence of this structure with that capsule internally lined by the synovial membrane with the secretion of the synovial fluid inside, they are known as synovial joints. See, except the articular area, everything from inside is covered by the, except this, the synovial membrane extends like this till this point. Sometimes this synovial membrane comes out to form the bursas with a little bit of fluid, semi-liquid fat sometimes present there. Sometimes this will outpouch to form the bursa around the joint. So bursa is nothing but a synovial fluid filled sac of the synovial membrane itself. So this is, again, bursas are made for the friction, to facilitate the friction around the joints of some of the tendons, which should not friction away, which should not tear away, which should not injure during this movement of the joint. So bursa, you may have heard this bursitis word somewhere. When there's a painful joint movement at some particular point, when you work too hard, there is a friction, there is a swelling, and you may get this bursitis some other day. Okay, somewhere in the life you may have experienced this, especially in the knee region, especially in the elbow region. They're common. Now, this synovial joints, based on its articular surfaces, are divided into too many types. Plain. Now you have those what do we say, hinge, the saddle variety, the ball and socket variety, the ellipsoid variety, the condyloid variety. A lot of joints are there based on only the articular surfaces. If they are, plain, allowing some of the friction, the plane, if there is allowing this hinge like movement, hinge, if they are having a ellipsoid shape of the bones from there like the wrist. So there are a number. And again, this particular joint chapter demands a special lecture. But at least this much you should know, while we provide you the review in a concise way. So we'll limit ourselves to few of the areas that you don't find too much to retain in this review lecture. Let us go ahead. There is another very important chapter in the general anatomy. This is known as muscles, where you study all the kinds of muscle that are in your body, their types, their muscle fibers. What is the function of muscle, how it contracts, how it gets its nerve supply, what are its different types, and basically repeatedly in the exam they ask the types of the muscles. Though functionally you should be aware of its nerve supply, its structure, exactly why it is named like that, the types of the muscle, their nomenclature. But in the full length video we can provide you the details of that. Today again we will limit ourselves to these types of the muscles that you have to know, because repeatedly again I am saying this is going to be asked in the exam again and again. So the muscle mainly functioning for the contraction. Now this contraction can be voluntary, involuntary, rhythmic throughout the life. You can control, you cannot control few of the things. Under the microscope, if you see different kinds of muscle, they have a little bit of different appearances, and that is what is mentioned here. If there is a multinucleated appearance like I have purposefully drawn here, and heavily striations are present in this kind of appearance under the microscope, high microscopy, rather high resolution, you see this kind of appearance called as striated muscle or the skeletal muscle because of the actin myosin heavy concentration. Now this muscle is the major muscle in your whole of the body, your arms, your legs, your forearm, your head, your abdomen, your legs, thighs, everything have this kind of muscle, that is somatic muscles or the skeletal muscle that you can control, and they need to perform heavy powerful action, and that is why they are heavily striated. Now we can see the location of that multinuclei on the peripheral side, whereas if you see the second kind of muscle, you see the central nucleus, only one nucleus in a cell, and the cell joined with a little bit of dark band also known as intercalated disc there, where in this first kind of muscle the bundles are running parallel to each other. Here the bundles are purposefully shown as branched, and this kind of muscle is known as cardiac muscle, exclusively seen in the heart. Some of the books may mention it nearby heart. At the basis of the beginning of that heart is again in the heart, but cardiac means heart. They develop when you are embryo and they function till you are alive. This cardiac muscle never fatigue, very much rich, and they have a peculiar intercalated disc, which is the gap junction, the communication junction, the tight, a little bit of adherent junction here. Between the two cells, you have those intercalated disc. Third type of muscle is known as smooth muscle, which overlap each other. The central nucleus cells are very much condensed around each other, and this stacked appearance is the characteristic feature of smooth muscle that are seen in the blood vessel wall, the visceral wall. So smooth muscle again involuntary in nature, and they don't have the abundance of the actin and myosin, so they appear plain. The striations are heavy in skeletal, they are very much less prominent in the cardiac muscle, and they are absent in the smooth muscle. So these basic tissues you have to know in the muscles.